The first item I'm going to talk to you about today is your sternal precautions. As you know from reading your heart surgery booklet, in order to access your heart to perform the surgery, the surgeon will need to cut your sternum/breastbone in half. Once they're done with the surgery, your sternum will be wired back together with some stainless steel wires. This wire will stay in your sternum forever and your bones will heal around it. It does not set off airport security detectors. It will take about 8 to 12 weeks for your sternum to fully heal after open heart surgery. In order to keep the pieces of your sternum together so that they can heal quickly and minimize your risk of infection, we have every patient follow sternal precautions for 8 to 12 weeks after surgery. The sternal precautions are: avoid all pulling, pushing, or lifting anything heavier than 5 pounds, about the weight of a 2-liter jug of milk. While at the hospital, this will particularly affect you when getting in and out of chairs and getting out of bed, as you will not be allowed to use your arms the way you normally would to push off the armrest or push off from the mattress. Avoid reaching or stretching your arms out to the side, behind you, or above your head. When wiping after a bowel movement, you can wipe from the front or from the side. Do not reach behind you to flush the toilet. You have to stand up and turn around and then flush the toilet. Avoid prolonged forward reaching, such as when driving a vehicle. You are not allowed to drive until 6 to 8 weeks after surgery. Your vehicle insurance will be null and void until you get your doctor's approval at the 6 to 8 week mark in order to start driving again. The next thing I'm going to talk about is what to expect in regards to your mobility from the day of surgery and up until you are ready to return home. On day 0, the day that you get your surgery, your nurse will teach you to do the following simple exercises. The beds in the CSICU turn into chairs at the push of a button, so your nurse may get you sitting upright in the chair position for a short amount of time. 6 hours after you wake up from the operation, you will stand up at your bedside with help from your nurse. On day 1, your nurse will help you get out of bed in the morning and have you sitting up in a chair for breakfast. One of your goals after surgery is to sit up in a chair for every meal. Usually by late morning or early afternoon, you'll be ready to transfer from the cardiac surgery intensive care unit to the cardiac surgery inpatient unit, which is where you will remain for the rest of your hospital stay. The day you transfer to the cardiac surgery inpatient unit, you'll begin your ankle pumping and deep breathing exercises with the physiotherapist, and the nurse will help you get up into a chair for meal times. On day 2, your activity will start to increase. The physiotherapist will come see you to teach you some seated exercises for your neck/shoulders and legs, and will get you up for your first walk around the cardiac surgery inpatient unit. Depending on how you do on your first walk, the physiotherapist will let you know whether you are safe to walk on your own or if you should continue to walk with the help of a staff member. Sometimes after surgery, patients can feel a bit unsteady, dizzy/lightheaded, or require some extra equipment to safely mobilize in the beginning. If this is the case, we would likely want you to go for your walks with the physiotherapist or another staff member until you are safe to go on your own. The goal is to go for 4 walks per day, eventually working up to walking the full loop of the cardiac surgery inpatient unit, which is about 90 meters for each walk. On days 3, 4, and 5, we want you to continue to sit up for all your meals, do your seated exercises twice a day, and go for at least 3 walks per day. On day 4, most people will be ready to try the stairs. The cardiac surgeons want every patient to be able to complete 2 flights of stairs while supervised prior to going home. While you do this, the physiotherapist will monitor any changes in your heart rate and oxygen level. On day 5, and sometimes even day 4, most people will be ready to be discharged home. Now I will explain the proper use of your sternal pillow. Everyone gets a sternal pillow to use for 8 weeks after heart surgery. The pillow will help you to 1. Protect and support your sternum or breastbone when getting in and out of bed and when standing. Hold the pillow to your sternum with both hands and don't be afraid to give it a strong hug, which will help to support your sternum by decreasing excess sternal movement while also helping to decrease pain to your sternum. 2. Support your sternum when you have to cough or sneeze. Coughing and sneezing puts quite a lot of pressure on your upper chest, so you always want to have your pillow with you or very close by in case you need it suddenly in order to support your sternum when coughing or sneezing. Again, Give the pillow a strong hug with both hands, which will help stabilize your sternum and decrease pain when coughing and sneezing. 3. Remind yourself not to use your hands. You've been using your hands for your whole life, and they will automatically try to do what you've always done. The pillow will help you to keep your hands occupied by holding the pillow so you do not use them accidentally and risk injuring your sternum. You are still allowed to gently swing your arms while you walk, which will help prevent shoulder stiffness. Make sure to bring your pillow with you in case you need it, such as coughing or sneezing, and hold it in your hand down by your side while you are walking.
And of course, if I'm holding the cushion, I'm not using my hands incorrectly when trying to make sure I'm not pulling on the sternum. What I thought was one of the things that I really found was interesting was when thinking about moving or not moving my sternum, just how my body worked in an engineering sense, if you will. That if you will, the upper body is like a barrel, and we've cut down the side of the barrel. And with my arms in that trying to pull on the sides of the barrel, it tries to pull it apart where that cut is. When I remembered that, it helped me to keep my elbows in, and it went well for me because my recovery has been, I think, pretty good.
I'm now going to talk about the importance of deep breathing after surgery. Deep breathing helps to prevent lung complications after surgery, such as infection and pneumonia. We want you to do 10 deep breaths every hour while you're awake during the day. Don't do all 10 in a row or you may get lightheaded or dizzy. Aim for about 4 to 5 deep breaths in a row, then take a break. There are 2 methods we will teach you. You will be given a device called an incentive spirometer that you will use to help with deep breathing. To use it, you'll exhale the air out of your lungs first, put your lips around the mouthpiece, and then inhale like you're trying to suck a thick smoothie up a straw. Your inhalation will cause the balls to move up to the top of the columns. The goal is to hopefully get at least 1 to 3 balls up and hold them up for 1 to 2 seconds. Don't get too fixated on the 3rd ball, as most people have trouble moving it. Focus more on holding 1 to 2 balls up for the goal of 1 to 2 seconds. The next method is very straightforward. Breathe in deeply through your nose and exhale through your mouth like you're blowing out a candle. Extra phlegm is common after surgery. We want you to try to cough it out rather than swallow it. If you're having difficulty clearing phlegm, try doing either of those deep breathing methods for 5 breaths to loosen the phlegm in your lungs, and then try to cough it out while supporting your sternum with your sternal pillow. Now let's talk about how to incorporate your sternal precautions when getting in and out of bed and when standing from a seated position. You will continue to move this way for 8 weeks following your surgery. To stand up, wiggle your way towards the edge of the bed or the edge of the chair by leaning side to side and walking your bum towards the edge. Once you're seated on the edge, make sure your feet are positioned under your knees and lean forward nose over toes while you stand up. If this is difficult for you, try rocking a few times first to build up some momentum and then lean forward and stand up. To sit down, back your legs up so that you feel them touch the chair or bed. As you sit, lean forward so you can get your bum as far back on your bed or in the chair as possible. This will help to minimize the need for extra repositioning after you've sat down. After surgery, you are allowed to lie on your back or on your side while in bed. You will just need to avoid lying on your stomach, as you would have to use your hands in order to roll over from this position. To get out of bed from lying on your back, bend your knees and use your legs to roll yourself onto your side by digging your heels into the mattress. Swing your legs over the edge of the bed. You are allowed to use your uppermost arm to push or walk your way up the mattress until you are sitting upright. Do not use your lower elbow to push into the mattress to help yourself out of bed, as this breaks your sternal precautions and can cause the 2 pieces of your sternum to separate from each other. Instead, use your lower arm to hold your pillow to your sternum for support, to minimize sternal discomfort and to help prevent you from accidentally using your elbow. Using your uppermost arm to lightly push yourself upright will cause the 2 pieces of your sternum to push together and therefore will not break your sternal precautions. To get into bed, first try to position yourself so that you're sitting near the top quarter of the bed in the middle of the mattress. You are allowed to use your uppermost arm for light support as you lower yourself down onto your side. As you're lying down, use the momentum to swing your legs into bed. Once you're lying on your side, using your legs with the knees bent to roll yourself onto your back. One of the hardest parts of this whole process is remembering not to use your hands the way you normally would. I would encourage you to practice getting in and out of bed this way and standing from chairs without the use of your arms before your surgery, as it will help to solidify the process in your mind so that you're not automatically tempted to use your hands like you normally would and break your sternal precautions. After surgery, the physiotherapist and occupational therapist will determine if you need any extra equipment when you go home. If you do, this will be arranged prior to your discharge. Finally, occupational therapy will review dressing techniques and daily activities while following your sternal precautions.